Familiar faces, worn out places, worn out faces, bright and early for the daily races, going nowhere, and the tears are filling up their glasses. No expression, no expression. Hide my head, I wanna drown my sorrow. No tomorrow, no tomorrow.
I'm Mike Nanini. This is my daughter Isabella. Ella's 4 years old, and she has a chromosomal abnormality, which has caused some severe physical and developmental delays in her. She's a very sweet girl, and we wanted to just come here and share our thoughts about the recent Medicare decisions in Virginia. It's tough on families with special needs because we just don't know what we're expecting, and we're all incredibly grateful for all the services that we get from our fellow Virginians and taxpayers and other people in the system. What we really have to struggle with is having changes to the benefits that we get. Just this recently, we used to start getting all prescription drugs covered under Medicaid. I went to get something today and discovered that because of the July 1, 2010 changes, we have to pay for those. Now, it's not a big financial burden for my wife and I to do that, and we're glad to do that. But what concerns us more are some of the more significant services that my daughter receives, especially night nursing. We didn't have that for her first 2 years of life, and my wife and I didn't sleep through the night for 2 years because Nala gets fed overnight. And that, nearly killed me. I got into a car accident due to lack of sleep as a result. So those are the types of services that are critical to families with special needs children. And those are the types of things that we just can't afford to lose. If we had to pay for night nursing out of our pocket, even with both of our jobs, I don't think we could afford it.
Also, with the change in pay, it's going to really affect a lot of the caregivers. The caregivers' main question and their main concern now is the change in pay. Everyone has to feed their family. Everyone has to feed themselves. And if you cut the pay, how do you expect people to live off of minimum wage amounts? And they're taking care of a lot of these clients with their heart, basically. And they will still do it, but they're taking care of them with their heart. But the pay is not sufficient for someone to live. The cost of living, how could you go back when the cost of living is just increasing?
The only thing that concerns us are the recent cuts in the reimbursement rate. 1090 is, I know it's above minimum wage, but I don't know if that is going to get people to come forward and do the types of services that people, or get the quality of people that you need to do assistance and provide care for children with special needs. So if there's any way that rate can be restored or improved, that would be really important for families with special needs.
I want to talk a little bit about my displeasure with the state of Virginia and the 5% cut in the Medicare rates. Right now, we're barely making it as a program to provide quality services for individuals living with disabilities. I think it's a travesty to take more funding away to lessen the service that we can provide for individuals with disabilities. Please, sir, please, ma'am, whatever you do, pass this bill to make sure that we have the funding that we need to provide quality services for people living with disabilities in the state of Virginia. I thank you for your time.
Even though I'm in a wheelchair, I feel like if I have the services if I have the services such as the home health aides or the nurses, I feel that I can live independently.
With the budget cuts coming up, my vital concern is that I will not have enough money to pay for a person like my trusted companion. I have been working since October. Some of the things we work on are social skills, getting out in the community, going out to eat, and most importantly, attending Spark. We also do fun things like play Wii, and he helps me with things such as personal care and going out on my swing set.
Hi, I'm George. I just want to say it's been a really great opportunity working with Ryan. We have a lot of fun together. I know his waiver allows him to pay for my services, and so it'd be really unfortunate if he didn't have that, because we have never gotten to be able to meet and hang out. We just have a lot of fun, and also we grow together at the same time. We're building a website that allows people to understand special needs a little more and connect together and such, and so we do a lot of great things together besides just
we're here today to also make sure that the legislature hears our voices for kids and adults like Sam, who are dependent on the Medicaid waivers. In particular, I want to make sure that the people who help Sam are not, their wages are not cut, and we want to rescind those cuts. So if your legislature listening, please make sure that you give Sam's caregivers a living wage.
There are plenty of clients who need assistance or need help at night, especially in the case where their caregiver is either hospitalized or is unable to be home in the nighttime hours. And the coverage to use for night ends up going into their respite care time, which ends up cutting back on that. And I mean, sometimes it's very important. I mean, who is going to be there at night for these patients, especially the ones who cannot move, cannot get out of bed, can't go to the bathroom, can't do anything without somebody being there to help them. And with the caregiver being gone, who do they expect to be there in the home with the client? Or the other client who is a flight risk and wants to go, and if somebody is not with him 24/7, he will be out in the wilderness and basically unheard. And that just brings to mind that quote about if a tree is fallen in the woods and nobody is around, doesn't make a sound. And that's how I feel.
My name is Frank Stephens. I am a man with Down syndrome, and my life is worth living. If there is no FMAP money, I might lose my job at Wildflower Caterers. Without my job, I would not be able to do the things Wildflower teaches me. My job is the key to my dreams. I dream of being an actor and screenwriter. I dream of being a leader, an advocate in my community. The self-esteem I learn in my job is the key to unlocking a life like yours. You hold the key to FMAP. So you hold the key to my dreams.
But I think what I want to share is a specific case that has led me to see how important policy and the bigger decisions that our government makes can really affect everyday people. There was a little boy who I'll call James. We got him home. He was at I Love Children's Nursing Home, an institution in Fairfax. He was said to be unresponsive, vegetative, blind, and that's what I assumed when I met him. I worked with his mother, took about 4 months of intense case management, and we were able to bring him home. We utilized the tech waiver, receiving 16 hours a day of nursing care. We also pulled from MFP, Money Follows the Person, and this is a program that has recently been extended. But this program provided so much support for this family. We were able to get them into a house that was much more accessible for him, put a ramp through the garage so he can get in and out easier. Clothes, furniture, appliances, you name it, we were able to get this house ready to bring him home. He came home on December 15th of 2009, where he's remained until today. He's done exceptionally well, and as much hard work as I thought I did in bringing him home, he's really done most of the work. We discovered he is not blind. He is actually able to see colors, shapes, and can differentiate lights. We also learned that he's not vegetative. He can respond to direct verbal commands physically. This increased his hours in his educational setting. He's getting an hour a day of homebound, and his ventilator settings actually had to be reduced. He's completely on a ventilator 24/7, requiring 24 hours of nursing care, but his settings had to be reduced because he was starting to breathe on his own. So this was a child who in an institution was vegetative. He was never stimulated. There was no reason to. He couldn't see, he couldn't hear, he couldn't respond. He's home, he goes to school, he plays with his little brother, comes in and puts cars all up and down his arms. He is responding, he laughs, he likes being tickled. He celebrated his 6th birthday outside on his patio. So all these programs really came together to support this family to not only bring him home, but to give him the opportunity to thrive in his community once he came home. Now, unfortunately, these supports are not these safe, strong structures that will stay for this family. They're really just pillars of sand that they are desperately relying on in order to be able to care for their son at home.
These Medicaid cuts are affecting me because they're affecting my attendance. If I lose these attendance, I won't be able to do anything. I won't be able to eat. I won't be able to get up out of bed. I won't be able to go to bed. I won't be able to go to the bathroom. I won't be able to take a shower. So you might as well say I don't exist.
I wanna drown my sorrow. No tomorrow, no tomorrow. And I find it kinda funny, I find it kinda sad. The dreams in which I'm dying are the best I ever had. I find it hard to tell you, I find it hard to take. When people run in circles, it's a very, very mad world. Children waiting for a day they feel good. Happy birthday, happy birthday. Made to feel the way that every child should. Sit and listen, sit and listen. I went to school and I was very nervous. No one knew me, no one knew me. Hello teacher, tell